citizens. And with that, I would like to introduce the best partner that I have throughout this, and that is the mayor of the city of Corpus Christi, Joe McComb.
Thank you, Judge. We're glad you took time to join us today. This is a subject of interest to all of us. The good news is, and I won't say it slowly, but I'll say it loudly, is that we have no cases in Nueces County currently. And that's about as good news as you can get. And if you want to maintain and stay up with that, you can go to the city website or the county website, and you will be as current as we are in terms of the status of the cases. Both the websites are updated daily, and today, because of a lot of activity and because of the community's response, we have no active cases. We have been monitoring folks since early February when the story started getting out, and we'll continue to do that as this goes by. The best defense is to stay informed, to stay educated, and to stay safe, and to use those practices that you hear on every television station or read the newspapers, radio. Let's continue to personal hygiene and taking care of yourself. And at this time, I'd like to ask Annette Rodriguez, our Nueces County Medical District, to come up and give you from the professional standpoint so that she can address that. But from a city and a county standpoint, just remember the good news is that we have no cases in Nueces and Corpus Christi. Thank you.
Annette Rodriguez. I am the health director for the Corpus Christi Nueces County Public Health District. I just wanted to let everybody know that we have been working the health district since late January on this coronavirus situation. We're in tune to everything that is going on. We have been in partnership with the state health department as well as CDC. We just want to make sure that the community stays in tune to the changes. It's a quickly evolving situation, and everybody really needs to pay attention to what's going on. And like the mayor said, there are no cases of coronavirus here in Nueces County, which is a very good thing. But in order to keep the no cases here, we need to do our job. And so the health department has been monitoring people. We've been actually asking for people to self-observe themselves as well to make sure that the community stays healthy. We've reached out to all of our partners, our hospitals, our healthcare partners. We've reached out to different community partners, daycares, nursing homes, you name it. Anybody that'll listen, we're talking to them, we're explaining to them the CDC guidelines, and if they have any questions, they can always call us. We do currently have a hotline that is set up. It is 361-826-7200. So we also have a website. Both the city has a website and a link to the DSHS and CDC, as well as the county. So we hope that you guys utilize these different ways of staying informed. We all know that there is no vaccine. We all know that there is no treatment currently for coronavirus. There is, though, vaccines for seasonal flu. So people need to stay and get vaccinated. There is treatment for seasonal flu. There is the antivirals, the Tamiflu that they can use. So what can we use for the coronavirus? They're called non-pharmaceutical interventions. Those are interventions like washing your hands. It sounds very basic, but it's truly very important. So if you wash your hands currently 7 times a day, increase it by 3-fold, 21 times a day. Really? Wash your hands as often as you can. That's very, very important. Also, social distancing is going to be so important. 6 feet, because when you sneeze, that's how the coronavirus is spread. It can actually go up to 6 feet. So stay at least away 6 feet from individuals that are sick. You should not be around sick individuals. We should try to stay as healthy as we can. So cover your nose and mouth when you sneeze or cough. If you use a tissue, throw it in the trash can and then wash your hands again. If you don't have a tissue, use the arm to cover your sneeze. So the other thing is that the most vulnerable population is the elderly, and you all have all heard this. So we've looked at the statistics from China. The elderly, those over 60, those over 80, do not do well with coronavirus. So part of our job, as the rest of us, I'd like to include us in the other 80%, is to stay healthy, try not to get the virus. You know, we all see it. It's traveling. We see there's Houston cases. We know what's going on, which is a good thing. Know what's going on. And people travel a lot. So when we say we're monitoring people or we're telling them to self-observe, it's because they're traveling back from China or from these places where there's a high number of infections. And so we actually are keeping an eye on them to make sure that they stay healthy so the whole community can stay healthy as well.
All right, great. Thank you, Annette. Annette, as she introduced herself, is the director of our health district, our health department. I just want to point out that that health department is a joint operation between the city and the county, and they do oversee the public health of our Nueces County. So that's about 360,000 residents, right? So 360,000 residents, including 325,000 in the city. So they have a very important job. One of the things we have done this week is met with Annette and her assistant director, Dr. Dante, and we're redirecting several staff positions from other departments in the city to help Annette and Dr. Dante out at this point in time to give more resources to address increased call volume, to help the community in awareness and education. So we've directed about 20 additional staff from other departments to the health department to include executive positions, call takers, even people that purchase commodities that we need. I want to point out that all of our departments, we have 32 operating departments in the city of Corpus Christi, and I met with each one of them earlier this week to have them begin to rethink their business processes. And so the Center for Disease Control, you've heard of that term, the CDC, they have issued numerous guidelines on how first responders, airports, and other businesses can change practices to do what we've been telling you, which is practice safe hygiene and reduce the spread of coronavirus. So each of our departments today is developing a change of business plans of how can they change operations to make them safer, not only for themselves, the employee, but for the community. And so as an example, if you call 911 today and an EMS paramedic shows up from the city, they may have a face mask on and goggles depending on the situation that they're responding to. That's a good example of a business process change that we'll see in our departments going forward. We've also asked all the departments to evaluate what are the most critical services that they perform. In case there is a large case of coronavirus outbreak in our city, we want to know what do we critically have to continue. And a good example of that is our water, right? We produce water for 500,000 customers. We need to make sure we have water every day. And so we're looking at what are those critical functions that need to continue and who are the critical staff and who's the fallback staff in case somebody does get sick. So that's important.